These are the tools that I'll be using for today's assessment. I'm going to begin by washing my hands. Hi there, my name is Tanya, and today I'll be doing an advanced neurological assessment. Do you have any questions?
No.
Okay, I'm going to begin with a cranial nerve examination. I'm going to have you close your eyes. The first cranial nerve is olfactory. I'm going to place this under your nose if you can tell me what you smell.
Coffee.
Yes, the patient's smell is intact. Next is cranial nerve 2, which is optic. I assess the patient's visual acuity using a Snellen chart at 20 feet. The patient's vision is 20/20. Next, I'm going to assess the patient's visual fields by doing a visual field screening. Okay, the patient is at eye level. I want you to continue to look straight ahead. I'm going to begin with both my hands behind your head. Once you see my hands moving simultaneously, I want you to say now.
No. No. No.
Okay, the patient's visual fields are intact. The patient sees both my hands moving simultaneously in all 3 locations. Next is cranial nerves 3, 4, and 6, which is oculomotor, trochlear, and abducens. I'm going to first assess the patient's pupillary reaction. I'm going to shine a bright light. Okay, the patient's pupils are 3, round, equal, and reactive to light. Next, I'm going to assess concentric pupil reaction. I'm going to shine the light in this eye as I look for pupil constriction in the opposite eye. Okay, the patient's concentric pupil reaction is intact. The pupils constrict when the light is shown in the opposite eye. Next, I'm going to assess the patient's extraocular movement. I'm going to have you follow my finger. Okay, the patient's EOMs are intact, movement is smooth, and there is no nystagmus. Next, I'll assess for accommodation as well as convergence. I'm going to have you follow my finger. Okay, now look at the wall and back at my finger. The patient's accommodation and convergence is intact. The pupils constrict and the eyes converge when the object is moved closer. Next is cranial nerve 5, which is trigeminal. I'm going to begin by having the patient bite down. I'm going to palpate the masseter muscles as well as the temporal. Movement is equal and strength is equal bilaterally. Next, I'm going to have you close your eyes. I'm going to assess the patient's sensation to light touch. Once you feel me touching you, I want you to say now.
No. 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 No.
Okay, the patient's sensation to light touch is intact. Next, I'm going to assess the patient's sensation to dull and sharp. Have you close your eyes. This is dull and this is sharp. Once you feel dull, I want you to say dull, and when you feel sharp, I want you to say sharp.
Sharp. Dull. Sharp. Dull. Sharp. Dull.
Okay, the patient's sensation to dull and sharp is intact. Next, to perform a corneal reflex, I would use a wisp of cotton. I would approach the patient out of line of sight from the side. Once I touch the patient's eye, if they blink, that is an intact corneal reflex. This patient's corneal reflex is intact. Next, I'm going to assess cranial nerve 7, which is facial. I'm going to have you smile. Now frown. Raise your eyebrows. Now I want you to puff out your cheeks. Okay, close your eyes and show your teeth. Okay, patient's movement is symmetrical and strength is intact. Next is cranial nerve 8, which is vestibulocochlear. I did a whisper hearing test on this patient and his hearing is intact. I also did a Weber and Rhine test. During the Weber test, the patient was able to hear sound equally bilaterally, and during the Rhine test, The patient's air conduction was greater than bone conduction. Next, I'll assess cranial nerves 9 and 10, which is glossopharyngeal and vagus. I'm going to have the patient swallow. Okay, the patient swallows without difficulty. Next, I'm going to assess the patient's uvula rise. I'm going to have you open your mouth. I want you to say ah.
Ah.
The patient's uvula rises midline. To elicit a gag reflex, I would insert the tongue blade slightly and lightly touching the posterior pharyngeal wall. This patient's gag reflex is intact. Next, I'll assess cranial nerve 11, which is spinal accessory. I'm going to have you resist against my hand using the side of your chin. Okay, now on the other side. Okay, the patient's strength is equal bilaterally. Now I'm going to have you shrug against resistance. Okay, the patient's strength is equal bilaterally. Next is cranial nerve 12, which is hypoglossal. I'm going to have you stick out your tongue. Okay, move it up, down, and side to side. Okay, the patient's tongue is midline and movement is symmetrical and equal. Now I'm going to have you push your tongue inside your cheek and resist. Other side and resist. Strength is equal. Now I'm going to move on to cerebellar function. I'm going to have you stand. I'm going to have you stand over here. You're going to walk on your tiptoes and now on your heels. Okay, movement is smooth, well coordinated, and well balanced. Now I'm going to do the Romberg test. I'm going to have you stand with your feet together, eyes open, hands to your side. Now I'm going to have you close your eyes. The patient maintains balance. Now I'm going to have you sit again. Next, I'm going to assess rapid alternating movement. I'm going to have you slap your thighs, alternating between the palm of your hands and the back of your hands like this, moving quickly. Okay, the patient's movement is quick and rhythmical. Now I'm going to have you touch your nose and touch my finger. Close your eyes, touch your nose. Now open your eyes and do the other hand. Touch your nose, touch my finger. Close your eyes and touch your nose. Okay, movement is smooth and accurate. Now I'm going to do deep tendon reflex. I'm going to begin with the bicep. Okay, biceps tendon reflex is 2+. Now tricep. Okay, that is 2+. Now I'm going to do brachioradialis. Okay, that is 2+ as well. Now I'm going to move to the lower extremity, doing the patellar. Okay, that is 2+ as well. Now I'm going to do the Achilles. Okay, and that's 2+ as well, and that should be equal bilaterally. This is the conclusion of my neurological examination.